Today, I want to talk to you about a bacterial infection that has symptoms, signs and symptoms that people would naturally wave aside or think, oh, maybe it's just a flu to go away and all of that. This bacterial infection is very common, but people don't take it seriously. That persistent cough that refuses to leave you after 3 weeks, you need to check it out. It may just be tuberculosis. Tuberculosis is a bacterial infection caused by Mycobacterium tuberculosis. It primarily affects the lungs, but can also affect other parts of the body. So there are different types of tuberculosis. The first one is the latent tuberculosis. For the purpose of this video, please, can I use TB? Thank you. So for latent TB, the bacteria is present in the body, but it's not active and it's not causing any symptoms. It also cannot be transmitted to another person. The second type of TB I want to talk to you about is active TB. In active TB, this bacteria is present in the body, actively causing symptoms and can be transmitted to other people. The third type of TB I want to talk to you about today is the pulmonary TB. In pulmonary tuberculosis, it primarily affects the lungs. Then the fourth type, the extrapulmonary tuberculosis. This type of tuberculosis affects other parts of the body. That's the kidney, the spine, the brain. So symptoms of tuberculosis differ, like ranging from person to person. One of the symptoms of tuberculosis is the first one, like I mentioned in the intro of this video, persistent cough. Persistent cough lasting 3 weeks or more is the first sign of tuberculosis. If you also experience unexplained weight loss at the same time with this persistent cough, you may have tuberculosis. If you have drenching night sweat, you sweat a lot at night. If you get chills even in warm environments, you may have tuberculosis. If you have decrease in appetite or and fatigue, you're always feeling tired, always, even after long hours of rest, you may have tuberculosis. So these are symptoms of tuberculosis. If you have chest pain, that's pain or discomfort in the chest, or you're coughing out blood or rusty colored sputum, you should see a doctor. You may have tuberculosis. These are the risk factors for tuberculosis. The first one, of course, is Mycobacterium tuberculosis. That's the bacteria that causes TB. The second one is close contact. If you are in close proximity, that's why I mentioned if you have a friend that has been persistently coughing for weeks, if you've been in close contact with somebody that has tuberculosis, if you've been exposed, you may likely get tuberculosis. Also, if you have a weakened immune system, for example, if you have HIV and AIDS, or you take immunosuppressive drugs, you may be exposed to, you're likely to get tuberculosis. Also, if you have a poor diet is also a factor. You're at risk of getting tuberculosis. Age too is a risk factor for tuberculosis. If you're under the age of 5 or over 65, you are at risk of getting tuberculosis. Diagnosis can be made by different tests. The first test is called the TST, tuberculin skin test. Tuberculin skin test. This test checks for reaction of the body to this bacteria. You can also diagnose tuberculosis by using a blood test that's checking for the body's response to Mycobacterium tuberculosis, or checking for the presence of this bacteria in the body. So TB can also be diagnosed by doing a chest x-ray. That's an x-ray to check for presence of TB in the lungs. Also, it can be also diagnosed by a sputum test. That's to check if there is presence of this bacterium in the sputum. The different treatment options. The first treatment option is by use of antibiotics. Antibiotics, a combination of antibiotics taken for at least 6 months can actually treat tuberculosis. Another treatment option is surgery. Yes, surgery. You heard me. In extreme cases or in worst case scenarios, surgery to remove damaged lung tissue, damaged lung tissue, and also repair other damages caused by this bacteria. Another treatment option that is available is called DOTS. That's capital DOTS, Direct Observed Treatments Short Course. This is a treatment plan where the patient is observed while taking their medication. This is a treatment approach. It's called DOTS. TB can also be prevented. TB can be prevented by vaccination. This vaccination for TB, it's called BCG. Bacil Calmette Guerin. I don't know if I pronounced that right. So BCG vaccination are given to babies under a year old and over a year old. It is injected intradermally just beneath the skin. And it is worthy to note that these vaccinations are usually popular in places that are endemic, where this particular disease usually happen in high numbers. That is where this vaccination usually takes place. That's in places like Nigeria, for example. In places like the US, you may not have heard of this vaccine, but there is vaccination for tuberculosis. Another way of preventing tuberculosis is by practicing good hygiene. Covering the mouth when sneezing or coughing can help to reduce spread of this bacteria. So that's another way of preventing it. Another way of preventing it is by taking screening tests that can dictate if you actually have this bacteria. Then another way of preventing it is a preventive therapy. For people that have latent TB, I remember mentioning under types of TB. That's TB that the person has it, but it's not active, the person can't infect and all of that. So you can do like an antibiotics therapy, so it doesn't go from latent tuberculosis to active tuberculosis. That's it for today, guys. Thanks for tuning in. Please subscribe, share, like, and tell me what you think about this video in the comment section.